So now we will discuss case hypergas acidity, and these symptoms are aggressive, acute. So as you know that in aggressive and acute symptoms, we always do sedation first. Yes. So in algorithm steps, these algorithm steps, these are part of level 2, Sujuk level 2. So how to do when this kind of situation appears. And I want to tell you one thing, that these algorithm steps are very good when the symptoms are expressive. If there are symptoms, then algorithm is first choice. How to do? First, stomach is located on the left side. You will choose left hand. So if problem is in the left area, your left hand first choice. If the problem is on the right side, then you choose right hand. But if the problem is located on the central area, then you will follow male and female criteria. I already discussed in the class. For female, you choose right hand. For male, you choose left hand, like this. Okay. So now, long bule, yesterday we did good practice of long bule. Okay. And you know that stomach meridian has connection with large intestine. So energy on the yang side flows from arm to leg, and then this large intestine is meeting stomach meridian. So you know this, okay? Now what we will do in algorithm, first we will choose stomach meridian, and you know that we have left stomach meridian and also we have right stomach meridian. So we will work on parallel these two meridians, left stomach meridian and right stomach meridian. These are two steps. And then in next two steps, we will focus on long bule pair. So stomach has connection with the large intestine, because large intestine meeting stomach meridian. So next two pair would be large intestine. Okay. So you will focus on left large intestine meridian and right large intestine meridian. Now how to start this journey? First, you will start, because left, you will start from left hand. And as if you are doing march past, left, right, left, right. If you start from left, then first is left, then second right hand, then left, and then right. If you start from right side, any disease on the right side, then you will start from right hand, first right hand, then left hand, right hand, left. So left, right, like this. So this is hand criteria. And now when you're doing treatment on the meridians, where is the location for magnet, and what step, tonification or sedation, how you will do on these four meridians. Let us see, let us practice on our this writing pad. I will share my screen. Sharing. Okay. Now you see. So left hand, I am choosing left hand because stomach is left side. This is stomach meridian. Okay. And this left stomach meridian is your first step, and right stomach meridian is your second step. Then third step is large intestine meridian. Fourth step is again large intestine meridian. But this first step is on the left hand. Second step is on the right hand. Then third step again on the left hand, and fourth step on the right hand. And we are using hetero joint for this. So we have three joints. So we are using top joint. Yes, top joint. So these are three joints. Yes. So we are using top joint. This hetero joint, as you know, the quality of hetero likes change. Hetero has quality of change. So this joint is very sensitive to, if you stimulate this joint and if you apply some magnet, it will quickly respond, because this is hetero and likes change. And what we want to do in disease, we want quick change from disease to wellness. Okay. So we are using hetero joint. So what I am doing, first we will follow simple pattern so that you can understand the rules and regulations. Simple pattern. because in algorithm steps, we have to be very, very clear. If patient has some discomfort in any of the steps, then you have to immediately change the direction of the magnet. But if the person doesn't have any discomfort, then you can smoothly flow with all 4 steps. So first we will do one case. Now this is one patient of stomach gas, and acidity. Yes. Now this is one patient and this disease. 4 patients have this disease. Patient 1, patient 2, patient 3, patient 4. In your clinic, these 4 patients are coming. They have the same disease, but their reaction to your application would be different. You have to be aware. That is why you cannot fix one algorithm set for all patients. So you have to focus. So let's say first patient comes for this hyperactivity of stomach meridian. The first patient, how I'm treating this first patient. So as you know that this is stomach disease and acidity, we will sedate as first step. Yes, stomach meridian sedation. Okay, and you know that energy flow direction we have practiced yesterday very well, and you know this. Okay, now I'm not focusing on energy direction, you know everything. So this is sedation. Okay, this is first step. And now we will ask patient and we should observe patient, his face reaction, how is he feeling, because already the symptoms are very acute and patient is not feeling good. So patient says, yes, very good. After this application, I am feeling better. Okay, but still the symptoms are there. So after until 2 to 3 minutes, 4 minutes, maximum 5 minutes, you can wait. But sometimes in 1 second, 1 minute, patient can show either aggravation or relaxation. If patient is towards relaxation, then but not fully cured, then you will do second step. And in some cases, patient says, after this application, my comfort zone is increasing and I'm feeling good. It means wait and see how much this magnet can help. So we are not in a hurry. We are you have to be very intelligent with this. Then this is stomach meridian sedation. So because patient needs more attention, not fully cured, and then we go to right stomach meridian. So see the previous step. If this is sedation, then you will do here in this case tonification. Yes, so this is tonification. You see energy flows from arm to leg like this. So this is tonification and this was sedation. So first step you did sedation. Second step, you have to see the previous step. If this was sedation, then you will do tonification. Okay, now after this pair, because patient says, yes, my condition is improving, but not fully cured, then you can go to the third step and you can work on the long bowel pair, and large intestine is making pair with the stomach meridian. Now, when you come to the large intestine meridian, third step, then please pay attention. When you're doing third step, please don't see this hand, just see this hand. What is the previous step? What is the previous step you have done? Okay, so the previous step is, this is sedation. So you did sedation. According to this previous step in this hand, you will do tonification. Okay, you see, this is tonification because this is sedation. This is energy gate, arm to leg. This is sedation. And here energy is coming from up. And this is tonification. Okay. So now step 3 is done and patient is feeling better. but still it is improving, but not fully cured, then you can go to right hand. And in right hand, you have to work with large intestine meridian, and you should see the previous step in this hand. What is the previous step in this hand? You did tonification, so you have to do opposite. Okay, opposite. If this is sedation, sorry, if this is tonification, then you will do sedation. So this was tonification, opposite is sedation. So in large intestine meridian, because energy flows from arm to leg, this is sedation. Okay, and patient says, now I am good, now I am good. And then you can tell your patient, the moment you feel good, you can remove all magnets immediately. Yes, sometimes patient can say after doing 2 steps, I am good now. Sometimes patient can say after 3 steps, I am good now. The moment the patient says that I am good now, you can remove, and you can just do some correspondence point of stomach, and then patient can go home. Okay, now let's see the second patient. The same disease, how he will react. So second patient. So you can write, because we are treating 4 patients, so you can write in your notes. Now I hope you are writing notes. You can write in the notes. This is the pattern, step 1, step 2, step 3. So you can write this is first patient, step 1, step 2, like this. Okay, you can write, and I will show you the practical. So second step, second patient comes to your clinic. This person also has the same disease, but see how he reacts. You will do sedation, because expressive symptoms. Patient says, okay, I'm good, better, I'm feeling better. Okay, then you go to right hand, and you will see the previous step. If you have done sedation, then your previous step would be tonification. So this is your tonification step. Okay, you see energy flows like this. So this is your tonification. But the moment you added the second step, patient said, oh, my pain or my gas acidity is increased more. This is aggravated symptom. Then first step was very good. You waited for 5 minutes, 2 minutes, 3 minutes, and patient was very comfortable. And then, but when you did second step, and patient said, now my symptoms are aggravated. And then immediately you will change the direction. Okay, you change the direction. And then patient says, yes, I am better now. Wait for a few minutes, 2 minutes, not more, 1 minute, 2 minutes, and see how patient is responding. And then patient says, okay, no aggravation, you can go next. Now you have finished stomach meridian pair, and next you will work on large intestine, because long beyond. So when you're working on large intestine in this hand, so when you are on this hand, don't see this hand. On this hand, see the previous step. What is the previous step here? The previous step here is sedation. So here you will do tonification. Okay, so this is tonification. Okay, now patient says, yes, better, I'm improving, good. So every step, actually this is beautiful game, joyful game. You have to be aware of patient symptoms. After this, you will do next step. So next step, this is next step. When you do next step, then you have to see previous step in this hand. In this hand, your previous step was, you see, sedation. Okay, your previous step was sedation. Then you will do opposite toni. If this is sedation, then you will do tonification. Okay, so this is the fourth step, and patient says, I'm good, I'm okay now. And then you can see, and you can tell your patient to keep these magnets for some time. But here you cannot say that keep this magnet for half an hour or 2 hours. You have to just tell your patient, the moment you feel good, you please remove. But it should not be more than more than 2 hours. If you feel better in 20 minutes, remove the magnet. If you feel better in 1 hour, remove the magnet. Or if you feel some discomfort, immediately remove all magnets. Okay, the moment you reach the peak stage of comfort zone, you should remove all these magnets immediately. Now you see, the third patient, the same symptom comes to you. So you, for example, you did all these steps, all these same steps. Patient responded like previous patient, but when you did fourth step for this third patient, the patient said, after this the patient said, oh, this is aggravated. Then you can also change this direction like this. Okay, now let us take fourth patient. Fourth patient, when you are doing, because this is hyper symptoms, the person has this stomach gas acidity. This is very chronic problem. Generally in chronic problem we do tonification, but when the symptoms are very aggressive, always we will try for sedation first, whether it is chronic or acute, because symptoms are very aggressive and expressive. So this is stomach meridian. Then what we will do, sedation. Okay, and wait, and patient says, oh my god, after this my symptoms are more aggravated. Then instead of sedation, you will do stomach meridian tonification. Okay, stomach meridian tonification. Okay, now I'm feeling better. Then you come to this hand, right hand, and then what you will do, you have to see the previous step. If you have done tonification here, then you will do sedation. And patient can say, oh, I am feeling better, then you will continue. If patient says again aggravated, then you can reverse the magnet. So I'm giving you various approaches, because if you understand the logic behind this algorithm, then on every step you are aware and alert. You should know all principles, all rules, but if the patient is showing discomfort, then you can break the rule. Yes. So now you did, in this case, you did sedation. Okay. And patient said, okay, I'm feeling good. Then what you do, next step, you come to this hand and then see the previous step in this hand. In this hand, this step, previous step is stomach meridian tonification. Here you can do, if this is tonification, then you have to do opposite. This is sedation. Okay, this is sedation, and patient says, I am better now, I am better now. And when you come to next step, here also, if patient says this is sedation, this is previous step is sedation, then you will do tonification here. Okay, this is tonification here. You see, you have parallel to stomach meridians. If the person has some hyperactivity, acidity, you never know, maybe his right stomach meridian is excessive, maybe his left stomach meridian is excessive. So this is very accurate algorithm steps. And energies are very intelligent. Energies will immediately tell you and will show discomfort. As a result, you reach the correct meridian. So in this case, we tried with the left stomach meridian sedation, but then after checking, we reached the conclusion that his left was weak. His left stomach meridian was weak, but his right stomach meridian was excessive. You see sedation here. Now, sometimes also this situation can appear. When you did this algorithm, this patient's 70% problem is cured, but then this patient 70% is cured, but you did this algorithm for 2 days, 3 days, but patient is this 30% problem is, not going, it is still there, then in this case you should do good correspondence treatment. Main system, insect system, mini system, this is so powerful. Please don't neglect this. Don't underestimate the power of your correspondence system. Okay, only thing is, if you don't find the correct point, then you are far from the result. And if you can reach the correct point in main system, insect system, mini system, together with this Sujuk E, you can really treat difficult diseases also. Only thing is, we have to pay attention to all these correspondence system also. Okay, so this is one step of stomach case. But now this, how you have to play game on these 4 meridians. Sometimes 1 meridian treatment is finished, sometimes after doing 2 meridian treatment is finished, sometimes 3 meridian, 4 meridians. So same pattern, you can work with all kinds of diseases which has expressive symptoms. Okay, like migraine, you start left migraine, you start with left gallbladder meridian, then right gallbladder meridian, then the long bule, gallbladder meridian, and spinal cord has long bule like this. So same pattern, same design, you can play with all meridians in different kinds of diseases. Only thing is, you have to be aware, alert, and see the symptoms of patient. Okay, and then accordingly you can reverse or you can continue your treatment, and I know you will do the best. I hope now you are confident, and we will practice many more. Okay, smile.